Welcome to Raising Daughters, the podcast that helps parents learn the best ways to support their daughters as they navigate the high levels of stress, anxiety, pressure, and uncertainty so pervasive in our culture today. Dr. Tim Jordan is a developmental and behavioral pediatrician who has specialized in counseling girls for over 30 years and sheds light on the realities of today's young women in all facets of their lives. This is your opportunity to learn how to better support your daughters, making them feel safe, secure, and truly loved in the midst of life's ups and downs. Here is your host, Dr. Tim.
Hello, friends. Dr. Tim Jordan back here with you with a brand new episode of Raising Daughters. Thank you so much for stopping by here every week and listening to a topic. I've spent a lot of time on these podcasts lately talking about older kids, young adults, people going into college, people in college. So I thought I would dip my toe into the other end of the pool today and talk about the other end of the age range, which is before kids are born, and talking about new parents, or maybe not a new parent, but just a parent who is pregnant, to talk about that whole process of preparing for having a baby, how you can get support. I asked an expert, her name is Kristin Revere, to join us today. First of all, thank you so much, Kristin, for coming on.
Thanks for having me, Tim. I'm excited to chat.
Kristin is an elite certified birth doula and an elite certified postpartum infant care specialist. She's a childbirth educator and newborn care specialist. She's the owner and founder of the Gold Coast Doulas and co-host of her own podcast called Ask the Doulas. My wife, by the way, was a Lamaze instructor a long time ago.
Oh, I love it. I took Lamaze with both of my babies.
Yeah, so when we first got married, she was teaching those classes. She was a postpartum nurse, and then she added that as one of the things. So we had 3 kids, and all of them with no medication, including our last one, John, who was 10-2.
Nice size.
So all that with no meds, which she really wanted. And of course, she had an incredible coach sitting right here.
I can tell. You attended Lamaze classes, so you know.
I did. So I wanted to talk today about several things. First of all, is there anything else that we should know about you?
I am a mom myself, and I have, my youngest is a boy. He's 11. I have a 13-year-old. So very relevant. Your podcast is, the timing is good for my stage in life. And then I have a stepdaughter who is 22, and I started dating her dad when she was 7. So I've been through many life stages with my stepdaughter as well.
And how'd your path wind to becoming a doula? I'm just curious.
I had kids late in life. I actually worked in advertising sales, in political and nonprofit fundraising, and became very passionate about women's health and realizing that there weren't a lot of local options in Grand Rapids, Michigan for a full service agency. I decided to teach classes myself as a hobby. After I had my son, I hired doulas with my son and worked with nurse midwives, had kids in the hospital, unmedicated through taking Lamaze. And so I felt like I prepared a lot, and I hired lactation consultants with both of my kids for 2 separate reasons. As my daughter was in the NICU and I had preeclampsia with my first. So feeding her was challenging with the goal of breastfeeding because she had enhanced formula, IV starting out. I was pumping. And so to transition when she got home from the NICU to breastfeeding took a lot of support.
Great. And just so I don't presume or assume anything, tell our listeners really quick what a doula is. I know what they are. All 3 of my kids, actually 2 of my kids who have kids already use doulas. And
I love that.
The third who is pregnant, they're also going to use a doula as well. But let our listeners know what that means.
So there are many different types of doulas, and we talk about the different types of doulas in our book, Supported Your Guide to Birth and Baby, that I co-wrote with Alyssa Veneclaus. And so there's everything from bereavement doulas to bed rest or antepartum doulas to birth doulas to day and overnight postpartum doulas. And so there are also some doulas that don't necessarily work with children that deal with loss for adults as well. So yes, we offer a full spectrum of doula support from, again, that bed rest or supporting loss, fetal demise, infant loss. And then, with birth doulas, doulas would be the most commonly known doula. And we support our clients with evidence-based information, physical support during the labor, and coaching, so that emotional support, and work with the partner and the birth team. So it could be a doctor or a midwife, the nurses, if it's in the hospital. We support our clients wherever they deliver. So they may deliver at home, they might deliver in a birth center or a hospital. We go where they choose to give birth. We're non-medical. There's a lot of confusion with the role of a midwife and a doula, and we are not medical in the way that a midwife is. We don't catch a baby. We're more of the coach.
My daughter had our first grandson 6 years ago, and my son-in-law did great. And they had a doula, and it was really helpful because her labor was, I think, 38 hours.
That's
she had
long
labor, and she had long pushing. And so the doula was extremely helpful for them to help give both of them support.
It's often a very physical role, whether a client has an epidural or not. We're changing positions with the client, helping with hip squeezes and counter pressure and labor massage, and showing partners how to do some of those techniques. So it is a physical as well as an emotional support role.
One of the things I wanted to talk to you about is I'm noticing that a lot of people who are having kids today, that there's a lot of anxiety, more than I think was in the past. And I'm wondering if you also are noticing that with the moms and dads that you are supporting.
Yes, I am seeing a lot of anxiety. I feel like it began during COVID. And in Michigan, we were fortunate in that we were considered essential workers. So we only stayed home for about 4 days and then were able to work in hospitals. Certified doulas, we went through health screens, we wore a mask for 2 years. So we were seeing a lot of that anxiety increase with restrictions for visitors in hospitals, with inductions, with the fear of COVID, and reducing visitors and family interaction. And some of those clients are now having baby 2 or 3 since the early pandemic. And that anxiety is still with them from that first baby and the pregnancy and the restrictions and the fear. And clients are also, like, similar to my own story of delaying childbirth and focusing on my career. I had kids later in life at 36 and 38. And so there can sometimes be issues with fertility. I didn't personally struggle with that, but certainly many of my clients have gone through other losses, miscarriages, IVF. And, with some of those prior losses, there is a lot of anxiety and fear that they might have challenges in their pregnancy and the birth itself. And with fertility journeys, again, that fear of losing the baby or all of the emotional and physical changes that happen through the IVF journey can also impact the emotional state of a couple. It's not just the mom, it's also the partner.
And people have always worried when they're pregnant, is it going to go to term? Am I going to have a miscarriage? Blah, blah, blah. And today people are waiting on average later. And I think it's after they turn, I'm not sure if it's 30 or 32, they're considered a geriatric pregnancy. And with that comes talking to a lot of young women. I mean, like, they get ultrasounds every 5 minutes, and not every 5 minutes, but like weekly, every 2 weeks, weekly. And even if there's nothing going wrong, just because of their age and they're at a higher risk. And I think sometimes the medical profession adds onto those fears. I know somebody they had all those frequent ultrasounds, and they would tell the parents, we noticed a little something on this ultrasound. It's probably going to be okay, but we should probably check this in a week. And this happened throughout the pregnancy. And I can't imagine I wouldn't be a nervous wreck, having all of that to worry about, much less the normal things we have to address as new parents.
Absolutely. And I know, having had preeclampsia later in my pregnancy, at 37 weeks, I was on bed rest. And then I was induced a week early. There was that stress of not only worrying about baby, but my own health. And, as a mom, even with a great support system, it was scary the second time I was pregnant because I didn't want to go through that again. I didn't want to have another NICU baby. I luckily avoided any sort of interventions. My health was good, although I did have some signs of preeclampsia the second time. And so I think whether it's gestational diabetes or preeclampsia or other medical issues, hyperemesis, that it can also cause some anxiety and fear.
I also wonder too, if maybe you're also finding this, there's so much information today that parents are grabbing onto, books and the internet and videos and YouTube, and there's just so much information, more I think than there's ever been, obviously. And information is not bad. I think sometimes a lot of the young parents I'm seeing, they get overwhelmed with it.
Right. And there are all these parenting groups, and they can give completely different information, and it may not be evidence-based. So as doulas, we can get research to our clients to have an informed conversation with their pediatrician or with their OB, and they can ask questions and feel like things aren't just happening to them, rather than taking advice of what someone did in their own parenting journey, something that might have worked for them. Or even family members, they're very well-meaning, but they're not pediatricians, they're not experts like yourself. And so they may not have the best information to give each family.
I think the other thing is, this is what I hear from them is, I think parents end up losing the ability to trust their gut. I think that extends and then into their parenting, because there's also a lot of information about how to parent and all that. And I think there's a lot of value in trusting your gut as opposed to looking outside of you all the time.
Yeah, we talk about that in the book. So in Supported, we talk about, trust your instincts even as a new parent. Certainly, look into research, but if something seems off with your own body or with your baby, bring it up and have a conversation with your provider. So yeah, our guts, they can be very helpful. And as moms, we do have some instincts. Right from the start, I felt very protective of both of my kids and could tell if something was off or not normal with their feeding, or my son having tongue tie. It didn't feel the same as breastfeeding with my daughter.
I think even this is what I remember from my Lamaze classes I took with my wife 100 years ago was my wife really wanted to do a natural childbirth. And I, as a former pediatrician, I haven't done medicine for a long time, but
okay.
I know the effects of those medications on the newborn baby and how it can affect, but also the ability of the mom to understand what's going on in her body. They lose a feeling of things. Sometimes it makes the pushing harder. So I think that's another place where I think sometimes women, and I guess men too, I think they lose the ability to trust themselves.
Yeah, agreed. And again, it's having all of the information at our fingertips is not the best. Many times being able to Google things, Googling information can often cause more fear than, again, going right to the pediatrician or a lactation consultant and getting expert advice.
I can see a woman in a delivery room with her phone Googling what's going on with my body right now, as opposed to tuning in to her own body.
And going inward and yes, trusting her own instincts and listening to her body and understanding what her body's doing by taking a childbirth class like Lamaze or hypnobirthing or even a hospital class.
We're talking with Kristin Revere. She is a doula and she works with parents to help with the whole birthing process. And she also is the author of a book entitled Supported, Your Guide to Birth and Baby, which she co-wrote with Alyssa Veneclas. Did I say that right?
Yes.
Yes. Which is a great book. I'm going to be passing this on to my son and daughter-in-law after we end this interview, because there's a lot of good information on there. I also wonder too, if you're also noticing in parents, because some of them are a little older to the game, if there's more of a sense of perfectionism that also they bring with them because they've been out in the workforce and I don't know, there's just something different about maybe a 21-year-old having a baby versus a 36-year-old having a baby.
Absolutely. And I mean, some of that is they wanted to, again, focus on their career or hadn't met the perfect partner, and they know what they want. They can afford to hire help. And I find that parents who waited often understand the value of support, whether it's getting a housekeeper or grocery delivery service, and not just registering things and having friends and family gift them physical items for a shower. They're asking for postpartum doula support on their baby registries, and knowing knowing that sleep is important to them. I mean, the older the parent, the more sleep is essential than a 20-year-old having a child, for example. And so we find, especially if, they're in a managerial role or they're a physician, attorney, that they're going to value sleep. They want to return to work and be at the same high level that they were before having their first child or their fifth child. And so they'll hire experts like doulas, newborn care specialists, to get them the rest that they need. Or their partner might be going back right away within a couple of days or weeks. Yeah. And so they value that support, and they've done the research well in advance and tend to hire us more so than, say, our younger clientele.
In one of the chapters in your book, the book, by the way, is called Supported, Your Guide to Birth and Baby. One of the chapters you talk about the importance of building a dream team of support. Can you tell our listeners what you mean by that and what you would include on a dream team?
Yes. And so every couple is different and goals may be completely different. And so you may have family in your area and don't need a lot of support from a postpartum doula, or, they're willing to help around the house. So it might be having pelvic floor physical therapy, again, lactation support, or someone to childcare for other siblings. So getting into a daycare center or an in-home daycare to be able to then focus on one child versus managing 3 to 4 other children. And really understanding, is it like who you want to be at your birth? Again, are you open to a birth doula, your provider of choice? And, some people, they value photography or videos of their birth or those early moments. So investing, similar to another life occurrence, a wedding or building a home, what is the most important thing to you for the wedding? Is it food? So some families really might want those postpartum meal delivery services. And they could be a local chef, or it could be a subscription box service, and things that save them time and, give them the nutrition that they need, especially if they're breastfeeding. They really want to focus on their nutrition and nourishing themselves and staying hydrated, for example. So it can definitely vary. It's based on what are the goals, what other resources do you have of friends and family members who may be able to replace some paid for services.
I would guess that 100, 150 years ago, all those people in the dream team were called grandma or grandpa, and because in general, we tend to live in the same town. We may have lived in the same building. It was easy for grandparents, aunts, uncles to be around. But I think nowadays, a lot of young people move away. They're in other cities. And so that built-in support is not there.
Yes. And again, so many of us are in that in-between age of caring for our parents and caring for children. So if they delayed having kids and are older, their parents may not be young grandparents, and they might need additional support from the parents as well as, care for their children.
Also in your book, by the way, we're talking to Kristin Revere, author of a book, Supported, Your Guide to Birth and Baby. She's a doula who's been working with parents for a while. You also talk in one of the chapters about postpartum depression, and also something I didn't realize, which was postpartum anxiety, and how that's oftentimes even more common than postpartum depression, which seems to get more top billing.
Yes. So we certainly, our postpartum doulas, our birth doulas, are on the lookout for any signs of perinatal mood disorders. And it can be anything from PMAD. So you're looking at depression, anxiety. There can be obsessive thoughts and so on. And we are always referring therapists, or we have an excellent program in my community that's a mother-baby program through Pine Net Rest, that you can bring your baby to the appointments during the day. So you're getting the support you need, but also being able to care for your baby. And then there are many postpartum support groups or lactation support groups that give resources and support with any sort of anxiety or depression or obsessive thoughts. And so we're always referring out if something seems off, we're having them talk to their primary care provider, their, OB or midwife, and then getting the help that they need.
I think this is true. If it's not, you tell me. I think for the majority of moms and dads, there's some normal amounts of irritability. There's some normal amounts of sadness. There's some losses that occur with having a baby, which we can talk about, or you can talk about. So I think some of that is just normal. I don't want to over dramatize it, because a lot of people who listen to these podcasts are probably thinking, this generation is spoiled and they need to toughen up and all that. And I think that's true at some level. So, but I also think that there's a lot of normal changes that happen before the birth, during the birth, and after the birth that just needs to be normalized for parents.
Yes, absolutely. And I mean, baby blues are hormone fluctuations. They're very common, not only in those first couple of weeks, but also when solids are introduced for breastfeeding moms, and other like weaning can also cause hormone fluctuation as well. So it's not just initially after birth that there may be some changes in hormones and may cause some of that weeping, sad feeling. And again, when our clients know what is normal and what is not normal, then they're able to get help. And I always say, with clients, they're seeing the pediatrician so regularly that if they're seeing something that if they're feeling off and need resources, sometimes they're in the pediatrician's office weekly at first, and they're not seeing their OB for 6 weeks. And so again, if they need resources and they don't have a doula, that's a good place to go.
I also think, and maybe this is obvious, but I think before you have your first kid, you have a sense of, I'm going to lose some of my freedom. I'm going to lose a little bit of spontaneity, of course. But I don't think they really realize the depth of that until you have a kid.
Right.
It's 24/7. And I think sometimes that can cause issues, lack of time for self-care, etc.
Yeah. And it's important to, take time for yourself and step out and just sip on some tea, have some normalcy, visit with a friend. And I find as a doula that, the pregnancy, especially for first-time moms, is so celebrated. And then after they deliver, it's all about the baby. People want to bring gifts for the baby. They want to hold the baby. But the mother and her feelings and her experience, whether her birth was traumatic or not, and her new role as a mother is often not something that people think about when they're trying to support. They think if they hold the baby and come over, when oftentimes moms feel like they then have to entertain and get food and snacks, and they want to feed the baby or go take a nap, but company is there, and then they have no one to process things with or to hear them, and they feel so lonely in a time that people want to help, but they don't always know how to help.
Another loss back in the day when I was a pediatrician that I used to see sometimes with parents, I think in particular moms, because they have a different kind of connection because they carried the baby for 9 months and all that. And they formed a relationship before the baby's ever born. They have dreams, they have hopes, they have aspirations, they have a sense of this is what my baby's going to look like and be like, what I want for them. And sometimes that's not what comes out.
Right.
And so sometimes they may get a child who's a lot different than they thought. And I think sometimes parents have a hard time reconciling that.
Yeah. And again, seeing a therapist or going to a support group and processing that. I even talk to my clients about journaling, writing out the birth story, writing out how they're feeling, taking some time and taking deep breaths. But really, when it comes down to it, sleep is so essential. So as they say, to sleep when baby sleeps, and try to get support, whether it's a doula or from a partner, to maximize sleep. With, many nights of lost sleep, then that just compounds that anxious feeling, the feeling that you're isolated and alone, or for the perfectionist mom that things aren't going right. And the more tired they get, the more things go wrong.
We're talking with Kristin Revere. She's the author of a book called Supported, Your Guide to Birth and Baby. I hope this is true, I'm wondering if today that things like doulas are much more acceptable, much more accepted. not so weird. Like things like yoga, everything there's a time when it's new and it's not what people are used to, and it takes a while for people to become accustomed to. Actually, this is a really valuable thing. I wonder if that same thing is happening with doulas.
Yes. I mean, starting out as a doula 11 years ago, it has definitely changed. People used to think that doulas were only for home births. We're very crunchy, not mainstream. My agency we pride ourselves on professionalism. We work with a lot of corporate clients and physician families. And so although some of our doulas are very natural and make their own baby food and so on, I think the role of a doula has changed in the public, but not in the media. If you see movies with a doula in them or a TV show, they're often more of that crunchier version of a doula than someone who is professional and works alongside a family. And there are many different types of doulas, and there's nothing wrong with either type, but I feel like we're more respected now in the medical community. I attend many conferences with other healthcare professionals, and we're much more accepted than we were when I was a new doula. And I don't know if part of that is Medicaid covers doulas in certain states, including Michigan now, and some self-funded insurance programs cover doulas. General insurance does not, but health savings and flex spending have for several years. And then there are fertility benefits like Carrot and Progeny that also cover birth doulas and postpartum doulas. And so that makes it more known if you're looking in your company benefit package. And if you have a doula, you may not have known about what a doula was, and now you do, or maybe a friend used a doula and shares that experience. So it's certainly changed quite a bit since I started out doing the work. And postpartum doulas are not as known as birth doulas, as I mentioned earlier, Tim, but they are getting more known as some of these benefits open up. And as I talk about in the book Supported, when you're looking at setting your budget for birth and baby the way you would for a wedding or building a home, what things are covered by insurance of the different dream team members, and what things might be valuable to put on a health savings or flex spending account, and what is important to you to self-pay. And so again, doulas might be something that could be partially funded, or registering for services like doulas or photographers and so on.
We mentioned earlier in the podcast about how parents are inundated with information, prepartum, postpartum, parenting kinds of things. And so sometimes some of those things are conflicting. So your book Supported, your guide to birth and baby. I know it's a whole book, so you don't have time to summarize it. But what was your reason for writing the book? And what's the most important kinds of things you want parents to take away?
I want parents to understand all of their options, because if you don't know your options, you don't have any. So I couldn't find a guide on the market like Supported. The closest thing would be to the book would be What to Expect When You're Expecting. But that's written by a mom and has had many different versions, but it's not from the role of a doula and knowing what our clients want. And the book came out of an online course that Alyssa and myself created during the early stages of the pandemic called Becoming a Mother. So the modules are very similar to our chapters, but not everyone can afford to hire us or take the online course, whether it's timing or budget. So I wanted to make accessible information, and the book being in so many different formats, it's soon to be out on Audible, and then has the Kindle version and the hardcover and paperback. So many ways to consume books. And I consume many books using the audio versions because life is busy. I'm in the car a lot and I'm doing household errands, and I like to listen to an audiobook. So I'm thinking that many, families will use that option, especially if they have a subscription already and they get a free book every month. So
you also have lots of references in here. You have apps that parents can get on that are supportive for people, when they're pregnant, about the delivery, about postpartum. So there's all kinds of good information in your book. So how can people get a hold of you?
So they can get a hold of me through the Gold Coast Doulas website, and that's goldcoastdoulas.com. And we're on Instagram, Facebook, Pinterest, YouTube, all under searching Gold Coast Doulas at Gold Coast Doulas. And then the book page is supportedbook.com, and you can search Supported Your Guide to Birth and Baby also on Amazon, but our book page has various booksellers as we add them, whether it's virtual or in-person bookstores that are starting to carry Supported.
It's called supportedbook.com?
Yes.
Okay, you're good. So I will post those links on my show notes. So if you're jogging right now or driving in the car, you don't need to start typing. So as always, I will put those links to get a hold of Kristin and her resources and her book on the show notes. Thank you so much for stopping by here and giving young parents some information. Also, grandparents, maybe second or third time parents. Everybody can use some information about this whole process.
Absolutely. Thanks for having me on, Tim. And I will continue to listen to your podcast and learn how I can support my daughters.
Okay. Thanks so much.
Thank you.
That was great. Hope you all enjoyed that. It's a little bit a different topic than you're used to hearing from me. Here's the book. It's called Supported, Your Guide to Birth and Baby. And I think it's an easy to digest book. Information is, and you're not going to be overloaded by this kind of information. It's a lot of resources and things you probably haven't thought of as far as the whole process when you're pregnant, delivery, postpartum, all that kind of thing. So I will have those links to Kristin Revere and her book and her services on the show notes. I'll be back here with a brand new topic in a week. I'm really grateful that you stopped by. Pass this one on to any young couple you know, or middle-aged couple you know who are pregnant, getting pregnant, maybe who are in the process of prepartum, partum, and postpartum. I think it'd be a good gift for them to prepare themselves for the process and for their experience. I'll be back here in a week with a brand new podcast. Thanks again for stopping by.
Thank you for tuning in to this episode of Raising Daughters. Hopefully you've learned something useful about girls and young women and how to help them navigate the pressures, challenges, and opportunities of modern life. If you want to become a more effective parent, keep listening to the show at drtimjordan.com and let the conversations shape you. Build that one-of-a-kind connection with your daughters in the most profound and meaningful ways possible, shaping them into strong, confident women of the future. That's all for now. See you next week for another episode of Raising Daughters.